When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome to Dr. Gore's show. So today we're going to talk about a very sensitive topic called depression. I think all of us know about it. At some point or the other, we felt a little bit hint of it. But to elaborate on this, I have Dr. Vasudev Makhija. Welcome to Dr. Gore's show, Dr. Makhija.
Thank you.
Dr. Makhija did his training in Bombay, KEM Hospital, and then he came to United States, did his training at Drexel in Philadelphia. He's been in practice in New Jersey for more than 25 years. Dr. Makhija has a huge, long biodata, but I'm not going to go into that. I'm going to just highlight that he's an immediate past president of New Jersey Association of Psychiatrists. He was a chairperson for Union County, and he's involved with a lot of community organization. He's a founder and a president of Samhin, which is a South Asian mental health initiative network, which is one of a kind, and we're going to elaborate on that as well. So Dr. Makhija, depression, we all talk about, oh, this one looks depressed, this is that. What is the definition of depression?
Depression is a medical illness which affects about 5% of US population. 1 in 4 Americans will suffer from depression at some point or another.
Wow.
It is worldwide, it is one of the second most significant cause of disability after heart disease.
Wow.
That the ultimate risk is suicide.
Right.
As we know from recent Robin Williams and several South Asian suicides that have been.
Correct. So, we as Indian, we as a South Asian are very, feel like it's a stigma if we talk about depression. We kind of try to keep it under the blanket kind of a way. But by hiding it doesn't mean it doesn't exist. So do you see that in your practice, like Indians are a little bit harder to come by, or when they come by, the depression has been a chronic condition, sometimes very difficult to treat at that point. What's your experience like?
I think the commonest thing is, most frequent problem is people confuse the depression, which is a clinical depression. Clinical depression would be something that requires medical attention, treatment, versus normal sadness, which is temporary. For example, when you lose someone or some tragic event occurs or some terrible significant stressor in one's life,
Sure.
Those may not necessarily require treatment. Stigma is a major roadblock to receiving treatment, and it is one of the most significant factors that keeps people from seeking treatment,
Right.
resulting in people suffering in silence behind closed doors. And that can go on for years. A few months ago, after I'd done a radio show, I got a call from a lady. She said, I didn't know there was treatment for this. Her husband had been suffering from depression for 10 years.
Wow.
So she finally, after that, got a treatment. She didn't know it existed.
Right.
She thought it was just the way of life.
Correct.
It is not a way of life. It is a medical illness that can be treated, and it can have significant risks. As I said, suicide can be the ultimate risk, but disability is a significant result of it.
Correct. So most people with depression will suffer from, they fail to enjoy daily things of life that we do enjoy. They have this apathy of things they used to enjoy to do it. They kind of want to sit inside, don't want to talk. They feel really sad most of the time. Some of us do feel sad during like winter blues, cabin fever, you're stuck inside for some time. But as Dr. Makhija said, some events in life, it's a normal emotion to have, death of a loved spouse, loss of a job, some events, and it's normal to feel. And especially I always bring up pregnancy and women's issue, it's normal to have postpartum blues, feeling, a little bit down. It's hormonal, it's lack of sleep, it's stresses. There's a lot of changes happening in women's bodies. So you do experience postpartum blues, but depression is like most of the time you're sad. Most of the time you don't want to engage in activity. So usually we as OBGYN tell their spouses to be lookout because, by the time the patient comes forward, they might, be really, really bad. So what are the symptoms you tell that if this is what you observe when somebody you are under treatment, that will be like a red flag, that you think that this is like a suicidal agitation, following examples that you'll tell the relatives to keep in lookout for?
I'll give you a list of symptoms that are often seen in depression.
Okay.
But before I do that, I wanted to make a point about the postpartum blues that you mentioned.
Correct.
As you know, in New Jersey,
Mrs. Cody made a...
Right, and we were involved, New Jersey Psychiatric Association was actively involved,
right.
Our task force, and then it became...
It's a law now.
Right, and with the screening.
Correct.
So yes, postpartum blues are common,
right.
But then at some point, if it becomes depression, that needs to be addressed, otherwise it causes serious problems. Having said that, the clinical depression that requires treatment is manifested by a variety of symptoms. Persistent sadness. Person feels very unhappy all the time, often for no reason.
Right.
And sometimes such sadness may be may vary from time to time. For example, in the morning it may be worse, typically what we call the diurnal variation. There is a loss of appetite, loss of weight.
Or excessive eating and excessive sleeping.
And there is other group of patients that will be opposite, where they will increase their appetite, eat more, and gain weight. Most people will have trouble falling asleep, or typically they will have trouble sleeping through the night, often waking up very early for no reason.
And then difficulty going back to sleep.
Correct. That they cannot get back to sleep. While other people with severe depression, they'll sleep excessively. They want to sleep all the time. There is feelings of worthlessness.
Right.
Their self-esteem goes down.
Correct.
They don't see the light at the end of the tunnel. Like when you lose someone, you don't see your whole life as being completely gone, hopeless, no happiness ahead. A severely depressed person sees no happiness ahead.
Right.
They cannot see beyond that.
Right.
They cannot see beyond that dark cloud.
Correct.
Then they can have thoughts of suicide.
Sure.
They lose interest in usual things that they normally enjoy.
Before, right.
Right. They could be like going to gym. They lose interest. Their hobbies. Somebody who sings will say no interest. They don't feel like practicing or singing or taking interest in taking
or going out, being with
going
friends,
out for dinners,
socializing.
Whatever social activities. They'll isolate themselves.
Correct.
Those are some of the symptoms. Now, not every individual will get all the symptoms.
Correct. So do you have some certain criteria, the DSM criteria that you have to follow to kind of come to a diagnosis?
These are actually the criteria from DSM. Now, one is how the person feels.
Correct.
The other is the person's functioning.
Right.
So the two important factors are, one, it should, all these symptoms that I mentioned, some or all of them, will cause significant emotional distress in the individual, or it will result in their inability to function, either at home or at work or in social. And usually, typically, they would say in DSM-5 that it is not a result of some other causes like some medical illness or some use of drugs or alcohol.
That you have to rule it out before you can label somebody. Or stressors of life. That is usually transitional, and they should be able to come out of it.
Correct. I mean, you can have stressor. A stressor can precipitate a clinical depression.
Absolutely. Or bring subclinical into clinical depression.
Absolutely. Correct.
So, apart from all the symptoms, you're going to tell the family to be look out for. Really, this person is not eating, as you said, and is kind of dehydrated. It's really affecting their medical condition. Say, suppose they are diabetic, they are not eating well, and stuff that can affect their medical condition. I think they should seek help, right? If they don't come out of a room or they don't want to go out for days together, I think all this kind of needs intervention.
Yes.
So you tell the family, their caregivers about all this kind of...
I think one of the things I would tell the caregivers is, one, when you see that, the simplest thing to remember is there's a significant change in the individual's behavior, mood, participation in family, social activity. If you see significant change, red flag should go up. Something is wrong.
Correct.
Be truthful and acknowledge it, that something is wrong. Talk to the individual.
Right.
Talk to the entire family, within the family.
Right.
Don't keep it a secret. It's not going to help anyone.
Correct, correct. And also, the depression sometimes is so tough because if that person doesn't take the medication, then they are going to get worse. So somebody has to always supervise. I always say, keep a track of the medication. Are they taking? Make sure they take it in front of you, because somebody who is depressed doesn't want to treat themselves sometimes, and that becomes really bad then.
Untreated depression, if someone doesn't get treatment for depression, it tends to linger on.
Correct.
And in some people, it may resolve in 6 months.
Right.
But in others, it becomes chronic.
Correct.
There's years of dysfunction, not functioning.
Correct.
They don't realize their potential.
Right.
Somebody may be an IT engineer, but they may not be able to function.
Right.
Not
right.
productive members.
Correct. And that's really a great point, that they kind of underestimate themselves and their self-esteem, and they feel worthlessness. And they really don't want to go out and do to their maximum potential. So it definitely affects their outcome. Even some of the housewives, when they are depressed, they don't want to do their, daily work. They don't want to participate with the kids or do cooking or routine stuff. They really get kind of
It gets ignored.
A step back. And that's what we ask people to kind of look for, those signs and symptoms, especially for women. So we've defined now depression. We kind of have looked into symptoms, and when they come to you, of course, you're going to get a great history and examination, and few of the things we'll rule out, as we discussed earlier, about substance abuse, alcohol, stressors in life, what kind of brought this up. Maybe seasonal, right? I think you see them during winter months, the depression rates goes up.
Yes. In fact, after you make the diagnosis, you look for other specifiers.
Sure.
Some people, they may have a depression,
Right.
but it tends to get worse during the winter months.
Correct.
And reverse seasonal, some people it gets worse in the springtime.
Oh.
So we do need to establish that also. If that is the case,
Right.
then that would impact on the treatment recommendations.
Correct. Also, you want to rule out manic depressive bipolar disorders, because if they are depressed at one point but they were really manic, I think that the diagnosis as well as the treatment is slightly different.
Absolutely.
So you really want to get into a detailed history.
Yeah, that is a part of the initial evaluation.
Correct.
Usually in the first session, the therapist, the psychiatrist will get all the detailed history,
Sure.
the past history, the family history, whether there have been manic episodes or only depressive episodes, any drug use, alcohol use, and other factors that may be risk factors
Sure.
and prognostic factors to assess where it's going to go with the treatment.
Right. So what are the common treatment modalities, of depression? We know there's pharmacotherapy, there's some ECT, psychotherapy. So is there a broad category of treatment for depression?
For the clinical depression, as I mentioned, that warrants treatment. There's a variety of treatment. Not doing anything is not a choice.
Correct.
Okay. Not every patient, every individual that suffers from depression necessarily has to be treated with medication.
Sure.
But most often, typically, individuals are treated with medication and psychotherapy.
Okay.
Psychotherapy is a very effective treatment for depression. The other things are more complementary, alternative types of treatments, some of which there has been now increasing research that it helps. For example, yoga.
Correct.
There are several studies that show that it does help depression.
Sure.
Some alternative medicine like SAMe and other over-the-counter nutritional supplies have been found to be helpful.
Right.
meditation is also helpful. In terms of the pharmacotherapy, there's a variety of medications available on the market. Luckily, the newer medications are much safer.
Sure.
Of course, all of them have potential side effects.
Correct.
Just like aspirin and Tylenol. Thousands of people die from aspirin and Tylenol. We don't even think about it.
Correct.
And similarly, antidepressants can have side effects, but almost like 70% of depressed patients can benefit from use of single antidepressant medications.
Right.
Those that do not respond will often respond by changing the medication.
Right.
And some people whose depressions are difficult will require more than one medication.
Sure.
And in very severe cases, especially those that might have psychosis.
Correct.
Psychosis means an individual loses touch with reality.
Right.
Or someone who's very suicidal.
Right.
One of the safest treatment is electroconvulsive treatment, what conventionally some people call it shock treatments, which has become very sophisticated now in terms of how it's used for benefiting the patient. And those are some of the treatments in brief.
Correct. We're going to take a short break and we'll be right back.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Gore's show. So far we've talked about depression. What are the signs and symptoms? How do we identify and what do we do? I think the points to remember is if somebody in your family, your friends, the behavior is changing, they are kind of avoiding things they like, they are always sad, they have this really like glass half empty attitude all the time, I think some of the symptoms might be of depression. I think to be encouraging, to get them to participate sometimes helps them to kind of overcome if it's really related to stresses of life. We do encourage people to kind of come up and look for those signs and get treatment early, because if it's easier to treat when it's in earlier stage, you might not need lifelong. If it becomes a chronic, I think then it's a little bit harder to treat. As we discuss, initially is a psychotherapy. Sometimes, I think what we always talk about, a night out with the girlfriend is real best treatment, because you can talk about your issues with your husband, your kids, very openly with your friends. So I think that is really important, to talk about your issues, psychotherapy, and get it out of your chest is, I think, one of the earlier form of treatment that you can do with your friends. If it doesn't get better, I think then you definitely should see a specialist who can help you with medication. Newer medications have least side effect. People used to see those movies, etc., about the shock treatment, people convulsing. It's not like that. It has changed over a period of time, and it's really reserved for very, very resistant cases, severe depression, suicidal agitation, when they need to be hospitalized at times. There are very easier treatment. We can start with one, and then if it doesn't help, as Dr. Makhija said, we can change it or add 2 ones. Sometimes we have to add few to overcome the side effects. And there's a wide variety of treatment available to psychiatrists now. Somebody who has weight issues, somebody wants to put on weight, there are different medications for smoker, non-smoker, and associated conditions. So there's a wide variety of gamuts of medications available. After we've done all this, if it's not better or any signs and symptoms, then definitely sometimes they need to be hospitalized and get other kind of treatment. Coming back to South Asians and Indians, Dr. Makhija, I find it very disturbing at times that, and I think I'm guilty of one as well, we at South Asian parents, Indian parents, have lots to ask from our kids. We expect them to, excel in everything, sports, singing, dance, Indian dance, Indian singing, and academically. How is that affecting, this older generation to newer generation? Has that led to, more cases of depression? And sometimes they feel very sad to come out and tell their feelings. And, recently we've had quite a few cases, especially in New Jersey, about campus suicides. And I think that's really a growing problem in our community. Any thoughts on that?
In fact, suicide, Kira Nahuja, she is advisor to President Obama on Asian matters. Her brother committed suicide 15 years ago. She was a keynote speaker at one of the organizations, American Psychological Association's annual meeting.
Right.
So it is a real risk. In terms of how we contribute to the stress of our children, I think we tend to focus heavily on the performance, which is not necessarily bad.
Right.
We want our children to excel. We all want to excel, which is a good thing. But when we do that and we see that as defining the children's identity,
Correct.
then it becomes a problem, because if the kid gets B instead of A, that means they're no good. We compare them to your neighbor's kids who's doing MBA, and it can be devastating. What that does is it creates a divide between the two generations. Kids stop talking to the parents about any of those details. We actually alienate them.
Correct.
And we don't develop and give them other options in life. We only push for certain careers.
Of course.
They have to be a doctor, or I think
Engineer
it
or
used to be
MBA.
a doctor and engineer. Now it's like
MBA, lawyer.
finance, a lawyer, and we forget there are so many other options, and we forget what the kids' capabilities and
Correct.
interests are.
Right.
You know, we define success from our eyes.
Correct.
And don't include our kids in that dialogue, and that is not very healthy, and that causes stress on the children.
Right.
And it's very common, the depression in children in colleges.
Right. So, all this kind of issues, I think we all, as I said, we feel it at some point in our life, going through, a big exam, big test. And it's okay to feel a little bit sad, if you don't do performance. But I think overall, to boost their, confidence is, as you said, what the kid is capable of is something that you want to keep in mind and kind of encourage them what they want to do, rather than have expectations and performance-based evaluation. I think sometimes.
Yeah, the biggest service the parents can do is tell the kids, you can talk to me.
Correct.
And not just judge them, and then be open to hearing what they are saying about the grades, about their study, about their choices of courses. Try to listen.
I think that's a very key point, is to listen to the kids, what they want to do, and have a dialogue. I think that's really important to have.
We can still advise, but listen.
Correct, right, what the kid is saying. So I think there are more and more resources available, especially for teenagers in the campuses, in the school. Sometimes our kids feel a little bit shy to open up and talk about it. They feel it, people are going to judge them. They're going to take it as a stigma from their, household. So even in colleges and schools, they really don't go to the counselor as often as, some of the other non-Indians would do.
In fact, what you made a very important point now. And now our kids are taught not to talk outside the family.
Correct.
They will say, like in Hindi, they say, "Hamare naak katwaega kya?"
Correct.
So the kids are afraid to talk to their own counselor, therapist in privacy, in confidence also, because of what we raised them with. We need to encourage them to be open.
Correct.
And to be able to talk and not worry about being embarrassed and shamed by it.
Or people, what they are going to judge them as.
Exactly. And nobody's going to judge them, but the kid needs to do that to get better.
Absolutely. And, in this regard, I think Dr. Makhija has started some hint for the same reason. So can you talk about some hint in short?
So I've been in practice for more than 25 years,
Sure.
and as you know, our South Asian population has grown significantly.
Correct.
And in some areas, 80%.
Right.
And with that, then increased awareness, our image of our community is that we don't have problems.
Correct.
I was at a dinner recently, very sophisticated, educated family, and we were talking about something, and the comment made was, "Oh, mentally ill people cannot volunteer, can they?" And that shows the significance of health, especially mental health illiteracy.
Correct.
What that means is you may be educated, you may be a PhD, but your understanding of the mental health
Correct.
is lagging.
Right.
which means understanding the nature of illnesses, the treatments available. People with mental illness have enriched our lives from time immemorial. Look at
Absolutely.
Robin Williams.
Absolutely.
All the great writers, composers,
Correct.
right?
Right.
Even in our Bollywood, we
Yeah.
have great actresses that have suffered mental illness but have enriched. Guru Dutt.
Absolutely. Guru, that was one of the
Guru
prime
Dutt,
examples.
Parveen Babi,
Right.
she was the first person from Bollywood on Time cover.
Correct. No, absolutely. I
enrich
think
us.
there is so much misconception
Misconception, misinformation.
in our culture about mental illnesses, because they think, oh, he's crazy. Craziness becomes a title, and that's why sometimes they don't come out with it.
Yes.
And it's a very generalization of a lot of symptoms, and it's a sad thing, because as you said, people might be educated in a lot of different ways, successful in a lot of different ways, but they have this whole stigma attached to mental illnesses. And I'm glad, and I think TV is one of the forums that we want to bring this up and have awareness that this is okay. These are very bright individuals who have contributed a great deal to society, but they do have, like any one of us, some flaws that they have to overcome, and we have to be very supportive and help them get proper treatment, I think, to avoid some of the mishaps which have happened.
So to that, and in terms of the mental health literacy, Summon's number one immediate objective is now education.
Correct.
We want to educate people, give them knowledge,
Sure.
so they can make better decisions. Knowledge will empower them.
Mm-hmm.
It makes them more confident.
Sure.
So to that, for educating them, we do a variety of outreach events
Right.
at temples, community fairs, radio,
Mm-hmm.
and now television. And I thank ITV and you for bringing us on the show. We appreciate that. I think it's a great service to the community. We do presentations, lectures at town halls
Right.
to educate the people. We are also developing free, searchable database on our website, which will be ready in a month or so, through which anybody can find a mental health provider of South Asian background, speaking a specific language, in a specific zip code. They can even search by gender. Some people want to see only a female therapist, or by some specialty. So we'll have that free available, and we are expanding that network that will be available free. Hopefully we already have the database. We just integrate it into the website now, in the process now.
So that's really going to be a great source for everybody to kind of go. As Dr. Makhija mentioned, the website is in progress, and you can see the website on your screen. And please do visit it as soon as it's ready. It will be up and going. But I think it's a great thing to compile all the physician information, their locations, and specialty-wise, that will make them a little bit easier to access, the illness and treatment.
Absolutely.
So thank you so much to talk about depression. I know it's a very sensitive topic, and I think you're doing a great job in this special topic of yours, where you're gathering all the information, you're making it easy access, and raising awareness. As I think the most important thing is to know what depression is, get it recognized, get it treated, look for when it's going really into a chronic or a very depressive stage, and get treatment. And I think we as South Asians should kind of be more aware to help out our kids, our friends, and all of us have stresses when we move to another country, and kind of having this community support is really going to help us. So if you have missed this show or you want your friends to see it, it will be available on YouTube. Go on www.youtube.com and search Dr. Gore Show and Depression, and you should be able to view this show again, or you can ask your friends, your kids, or a relative to see it. Thank you so much. Till next time.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.